Hi, everybody. This is Namrata Kalia, your admin at Momz and More. Thank you so much for joining in yet another interesting live session. We keep having these live sessions. We keep bringing topics that are very, very relevant to you. I'm sorry, I know we started a few minutes late, but that's how technology works. You just don't know what's going to happen when. And today's live session is on a very interesting topic. And before I talk about the topic, let me wish you all a very happy Mother's Day in advance. We mothers do so much, but do we take care of ourselves? Do we pay attention to ourselves? Our interest, our center focus is always our children. But today we are going to talk about our health. We are going to talk about our children's health, the eye care for moms and kids. And that is the topic that we have on hand. How to take care of your eyes, understand various issues, and get all your queries answered. Thank you so much, Mona. Could you let me know if I'm audible and if I'm visible? That would be a big help. Thank you. To do that, we have with us Dr. Shalini Jain from Samyak Eye Care Clinic at Vaishali, Ghaziabad. I will formally introduce her. I'm just waiting for a few more people to join in. So, as I was saying, Mother's Day is right around the corner, and I know I'm a mom, right? Still, everything becomes about our children. We are focused on them, and we somewhere down the line forget that we need to take care of us as well. And eye care is a topic that we haven't covered in the community yet. And yet, it is so, so important. Are you taking care of your eyes? Are you going for regular checkups? When are those checkups needed? We will cover all of that. You know, there is a saying, a vision for a great future starts with a good eyesight. And this is so true. You know, these days we see young kids with glasses and power. My daughter is no different. She got her glasses when, the lockdown happened and the classes moved online. And I was a worried mom. And I wish we could have had this session then. But better late than never. Dr. Shalini Jain will join us and she will take care of all your queries. And I know you have so many questions. You've already pinged me with your questions. We will make sure that we take care of all your questions. And if we don't, we do have her number shared. If you see the description of the live, her number is shared, her website details are shared. You can connect with her directly as well. So let me get Dr. Shalini on stream with me. Hello, Dr. Shalini.
Hello, hi.
Thank you so much for joining in this interesting and insightful session. This is our Mother's Day gift to all the moms in Moms and More. And I'm going to, formally introduce you. Dr. Shalini Jain has been awarded PhD in the field of clinical optometry. She is currently serving as a senior consultant optometrist and vision therapist at Yashoda Super Specialty Hospital, Ghaziabad. And she's also offering her comprehensive services at her own Samyak Eye Care and Vision Therapy Clinic at Vaishali, Ghaziabad. So again, Dr. Shalini, thank you so much for joining in. We have lots of questions and we are going to use your expertise.
Yeah, I'll try to answer all the questions.
We will make sure, because as I said, when we introduced the live session, there were like so many questions pouring in at the same time, and we will try to cover as many as we can. So I do see people joining in. If you missed out on something, you can see the live session again. So recently, we conducted a poll in the group, Dr. Shalini, wherein we asked a few, the common issues that parents have, things that they worry about. It was, do screens these days actually impact the eyesight of children? The second topic on hand was, are tablets, phones worse for children's eyesight, or, in comparison to TV or laptops? And the third poll question that we added was, if your parents have power, will you also end up having power? So let's take each question one by one. Since like this, the top ranking poll that all the moms wanted answered was, do screens lead to power number in kids?
Yeah. Actually, screen and the smaller screen impacts on the eyesight a lot. Whenever we try to see things, smaller things with a pressure or strain, it creates minus number. This is called myopia or short-sightedness. Nowadays,
Okay.
after lockdown, what we are facing a lot of minus numbers. Kids are coming with lot of minus numbers. It was not there before 1 year or 2 years, because of lot of use of all these gadgets, small gadgets, tab, mobiles. Smaller screen creates more impact on the eyesight. So I always suggest, if you want to attend some online classes, shift to a bigger screen. Smart TVs are the better option than the smaller screens. So don't use too many digital devices. Our international survey says, like, lot of near activities on these gadgets create lot of minus numbers. So avoid the gadgets as much as possible and increase outdoor activities to decrease the
Okay.
number. Okay, what was
Perfect.
your second question?
Yeah. The second question was, you already actually covered both of them together, the screen impact and small screens versus like bigger screens as a TV. And the third thing that was asked was, if your parents have numbers, so I do have a power number, is it automatically assumed that your child will also have power? Is there any truth in this?
Namrata, actually, genetics play some role in the situation. Like, we are just like our parents, but it is not a thumb rule. Like, if my
Okay.
parents have number, I will certainly have. No, it's not like that. And in nowadays scenario, the genetics has very limited role. Our parents do not have glasses, but my kids have glasses. I didn't have any glasses for distance, but my kids have glasses. So nowadays, the genetics is not a very key role. It's not 100% true. Maybe the parents are not having glasses, kids may have. Parents have glasses, kids may not have. So genetics play some role, but not 100%.
So yeah, so there is some
But what,
impact of,
yeah,
yeah.
yes, there is a connection, because the whole structure of our body, our organs are, DNA based structures we have. So whatever DNA we are getting are from the parents. So what we
Yeah.
generally suggest to our patients, like, every child should have an examination at the age of, starting from the age of 6 months. But if the
Oh,
parent, if they, yes, it should be started from the 6 months, because as the child grows, like, we learn how to talk, how to walk, everything we learn. Similar way, our eye learns how to see, how to gather information correctly. So every child should get examined at the age of 6 months. But suppose sometimes, there is no family history of numbers, then parents are not going. But in case of genetical parents, like they have myopia or any kind of refractive error, the child should be screened from the age of 6 months.
okay. So this was
Just to know
brand
that.
new information, Dr. Shalini. I hope the new mommies are listening to what Dr. Shalini just told us. We a lot of time assume that it's not needed, eyesight, मतलब चल रहा है, बच्चे देख रहे हैं, you don't need to get it tested. We only head to a doctor when things become really, really severe.
Yes, when the
But
child
regular,
complains,
yeah,
we wait for the complaints,
yeah,
till the time child doesn't complain, we don't go for the examination. This is the
yeah,
biggest problem.
yeah,
Generally, we don't correlate vision and learning. Vision is directly related to the learning, and the starting years of the life, the tender years of the life, from 0 to 6 to 8 years, are the very important years for learning of
yeah,
everything. You're getting exposed to the world, you are getting exposed to many kinds. Similarly, the eyes are also getting exposed to many things.
yeah,
If the child is lacking in vision or any other visual ability, he may lack in the class, he may lack in other visual performances. The academic performance will be affected because of this. So, internationally, our association says the first examination of a child should be an eye examination.
wow,
If we talk about 20-25 years back, generally the doctors used to say, when the child learns how to read ABC, then you get the child for the examination. Okay, most
yes,
of the time
yes,
there is a confusion. How will you examine the child? He doesn't know ABC. How will you
yes,
examine? So the my thing is, like, this information should spread. We don't need the child should sit and read. This is objective assessment, we are trained for that. Okay,
Yes.
we know what is the refractive status at the particular age, and we correlate in that way. Okay, if the child has number and we are not correcting in the initial ages like 0 to 6 years or 7 years of age, the child will not develop full vision like 6 by 6 or 20 by 20. And the age of 7 or 8, he comes to us and he says, now I'm not able to see the classroom blackboard.
Yes.
At that
Yes.
time, sometimes we are late. We are not able to, correct the vision
Yes.
up to 6 by 6. This is called lazy eye or myopia. So the early years are very important. So don't wait that my child will go school and learn ABC, then will go for an eye examination. Or till the time child is not complaining that I'm not able to see blackboard or anything. Don't wait for that. Just like a routine, once in a year examination is important
Is a
for
must.
every one of us. It's a must.
Dr. Shalini, again, I am so glad that we have you here today because I belong to the old school thinking myself. I got my daughter, her eyes checked when I was sure that, okay, now she can read A, B, C, D.
Yeah.
So
So
now she
that's it.
will be
It's a
able to tell
common
us,
myth actually.
yes.
It's a
And I
common
think
myth.
that did lead to her having a higher power in
Yes.
comparison to had we taken her earlier
Yes. And
for
and
a regular
and,
checkup.
and other than this, the lives, like the span she passed in dark or blurring of vision. Other schoolmates were comfortable seeing things.
Yeah,
She was not throughout those
yeah,
years because it
yes,
hasn't come overnight. She has developed
yeah,
slowly. Okay, so all the time she was facing difficulty while other kids were comfortable.
yes. Totally. So, mommies, don't think that eyesight can be ignored till your child reaches 5, 6 years of age and they can read and write or
That time
recognize
we are very
letters.
late. We are late.
Yeah, yes. So, please consider an eye checkup at least once a year. Go for a regular eye checkup. Dr. Shalini, you used a term a few times, myopia. If
Yeah.
you could explain on that, what does that mean to a layman?
Yeah, myopia, if we talk about it, means short-sightedness. Means the person who has minus number will be able to see things closer. You know,
Okay,
2 meter periphery, 1 meter periphery, but up to a distance. When we talk about distance, we always talk about 6 meters or 20 feet away. Okay,
okay.
the common
Mhm,
example. I'm telling you the live example of this. For the
mhm.
last 2 years, our kids were bound in home. They were doing all near activities. They never
Yes,
realized that they have got some difficulty for distance because they were not using distance vision. They were short sighted. The
yeah,
time they went to school, now they are complaining to the parents, I'm not able to see the blackboard from the front line or from the back seat, or I'm not able to see the blackboard at all. What is that? It means the child was facing some difficulty for distance vision. This is short
yes.
eyes or short sightedness or myopia, and it is directly related with our near work. Lot of near work induces myopia. So
Okay.
just to slow down this, and this is a progressive condition. Progressive condition means when our height increases, eye length
Mhm.
also increases and minus number increases. So there's
Okay.
initial ages like 0 to 18, 19 years of age. These are very crucial time for myopia. Means the slowly the minus number increases with time, and we can slow it down with the help of
Okay.
few environmental changes and few specially designed techniques. Environmental modification means no to digital gadgets. No. Outdoor
Yeah.
activities, minimum 1.5 hours or two outdoor activities.
Yeah,
Just
because
remember,
it increases the vision of the child,
yes, distance
Yeah.
fixation. We
Distance,
need
yeah.
distance fixation to relax. These two things actually causes myopia, other than genetics. So
Understood.
we can certainly work on these two factors: no to digital gadgets and lot of outdoor activities. And there are
Oh,
specialized glasses and contact lenses also available to slow down
okay.
myopia. But those
So
are
it
second
can be
step.
slowed down.
It can be
That's the
slowed down.
thing.
Yes,
Okay.
we can
So
slow it down.
that's good to know that it can be slowed down because you feel that once your child has power, it's going to increase like that. So again, we'll cover that topic later. You
Yeah,
again mentioned another term, and there was another mom who was worried about it too, amblyopia. It's also known as lazy eye, right?
lazy. Yeah,
Yeah.
this is a
What does
topic which
that
is
mean?
which is
Yeah.
very close to my heart actually. Lazy eye situation is basically a developmental thing. Just now I told you like why early examination is important.
Hmm.
Because if we examine the child early and we find that the child has got some number or difficulty for seeing distance things. We can
Mhm.
introduce correction or whatever management is required at particular point. If we are not providing that correction, then the child will not be able to see properly.
Hi, Dr. Shalini. I'm not sure if it's my connection or it's. So, if viewers could let me know if I'm still visible and it's only Dr. Shalini, then we'll figure out. So, if it's my connection, I can do something about it. Yeah, so that's what happens when you have online sessions. There are so many glitches that we cannot control. So, if somebody could just let me know if it's my connection, if you
Just a
can
second.
see me.
Sorry.
Yeah, Dr.
Yeah,
Shalini is back.
I think there was some interference in
It's
between.
totally fine, Dr. Shanti.
Yeah,
Please, please go ahead.
you are not clearly visible, Namrata. Now
Okay.
it's okay. So what I was talking, like if I give an example, like I haven't used my this hand since birth, and at the age of 9 years, I want to use my this hand. I won't be able to use this hand throughout my life. Similarly, if the child has not used the vision correctly up to the age of 6 to 8 years of age, whatever is
Mm-hmm.
the condition, maybe because of the refractive error, means the glasses number, or any other condition, developmental conditions, vision does not reaches up to the mark, and at that
Mm-hmm.
stage we cannot develop the vision, because that was the
Okay.
developmental stage that was over. That's why I always emphasize this: just go for the eye examination once in a year, and
Yeah.
we don't need that child should read ABC. Till the time
Understood.
you come to us, it will be very late. So it's
Yes.
highly important. Nowadays it's a very competitive world. We all of us should have 100% abilities, 100% performances. Till the time my vision is not correct, I cannot achieve 100% in my life. So
You
it's
are so right.
basically, yeah, it is basically a gift to the child. If we give a good sight since beginning, his performance in everything will improve. He will access in the life. So it is directly
Fantastic.
related. It is related.
You yourself imagine if, I mean, you, let's say, blindfold is like, maybe even if you put on a translucent
Yeah.
blindfold, right? You wouldn't be able to see things. Imagine, because when children are young, they don't even know why it's happening. So,
Yes, and they're not,
as a
and they
parent,
cannot
yeah,
express also that they
they
have
cannot.
this difficulty. They don't even know that they have this difficulty. This is our
Exactly.
duty and responsibility to get them checked, and whatever is required, we should do at the correct age so that they should get 100% of their vision.
So you just mentioned lazy eye. So let's say somebody does, because as I said, a mom had shared her query. I think her cousin has um, lazy eye and he's fine. Is there anything that can be done to correct it? Is it possible? I think there's a internet issue again. But till the time Dr. Shalini joins back and our internet is okay, we can talk about the topics that she already covered. Which is the most important thing, please don't wait till your child is 6 years old or 8 years old and you think, okay, now मेरा बच्चा ABC पढ़ सकता है. So अब हमें पता लग जाएगा कि उसको power चाहिए कि नहीं, if that child needs glasses or not, because doctors are equipped enough to understand if your child needs glasses or not. So a yearly checkup is very, very important. Again, to all the mommies who have, okay, thank you so much, Yasmin, because I was worried. That is one thing I was worried about, if you can see me or not. Dr. Shalini will join back. As I said, we are all dependent on technology, and technology does, sometimes give up on us. But there are some really, really important topics that we covered. As I said, and because I am a mom to a daughter who has glasses, I can say with personal experience, I was one of the moms who thought that she did not need to take her child to an eye specialist till the time she learns, ABC, and she could recognize letters. But I think had I hurried, I had taken her earlier, I would have known, and we would have caught uh, with it earlier that she needed glasses. So please, yearly session बहुत जरूरी है बच्चों के लिए. अपने लिए भी अगर आपको glasses नहीं है, you don't need glasses, you don't have a power, still just go for a session with your child, because it's important to know if everything is good, because we see the world through our eyes. Okay, Dr. Shalini is back. Yes.
Yeah,
Hi,
something
Dr.
went wrong.
Shalini.
Yeah.
Yeah, welcome back.
So we were talking about lazy eye.
Yeah.
Now, this was the part like early intervention, like what we
Mhm.
actually do in lazy eye. First of all, we have to assess like what is the cause of lazy eye. Most of the time, it is uncorrected refractive error. Refractive error means
Okay.
glasses number.
Okay.
Sometimes there are situations like congenital cataract, means the cataract is present since birth. There are other conditions also, but most of the time, what we face is uncorrected refractive error, glasses power. So there are multi-steps treatment for lazy eye. First step is correct glasses.
Okay.
Secondly, there are specialized therapies, customized therapies. Those are called vision therapy.
Okay.
Vision therapy is customized according to the cause and the age of the child in association with patching. So there are multiple therapies and steps, but child gets 100% vision, but it should be intervened in the early stage. If we are doing it at the age of 8 9 years, we may not get 100%, but if the child is 5 years, he will definitely gain vision. But we should start early now. We should not
Yes.
wait further.
And the only way we can start early is when we are going for yearly checkups. We know
Yes.
what's happening and we are cooperating with the doctor, and it's good for our children.
Yes.
Yes. So,
For,
Dr.
for the
Shalini,
future of the
sorry,
children. It is
please
for the
continue.
future of the children.
Yes. Yes, exactly. So, Dr. Shalini, one more thing. Another term that you hear a lot when it comes to children is squint.
Yeah.
What is squint? What is this condition? Is it curable or is it permanent? Again, we would really, really want you to talk about it.
Yeah. Squint is, we can say, like when we are looking to you, like we are looking at each other, our eyes are straight. This is
Yeah.
straight position. Sometimes you must have noticed like the person is looking at somewhere and the eyes are moving in some other direction. This is called squint, means misalignment of the two eyes. They are not coordinating together. Okay, one eye is
Okay.
going this way, other eye is going that way. So that's squint. Most of the times squints are correctable. We
Okay.
first of all we have to analyze what is the cause of squint. Now again, squint is something when our brain is not able to control the movement of the eye. Our eyes are controlled by six pairs of muscles. Okay, and brain keeps the control of the eyes. Like when I am looking at you, my both eyes are coordinating in the same way. Who is
Yeah.
controlling that? My brain and my muscles. When there is a control is not there, then brain is not able to hold that muscles and the eye goes in some other direction. This is called squint in a simple way. Now first of
Okay.
all we have to assess what is the cause. Most of the time the cause is refractive error again, means the glasses number. One eye has smaller number, one eye has smaller correction of power, other eye has higher power. So the image clarity, the one eye sees better than the other. When one eye is seeing better than the other,
Mhm.
brain appreciates the image of that eye only, and it is not bothered about the other eye image. So the control is lost and the eye goes in other direction. So most of the time when the cause of squint is correction of glasses only, they are correctable with the proper glasses only. Sometimes there are other causes also that we have to assess, like whether there's a muscle palsy or there are other conditions. But most of the times squint is corrected with the help of special glasses, and their vision therapy again is a helpful tool in correcting squints. There are certain situations where we have to go for surgery, but decision of surgery also depends on correction of squint with glasses and therapies. What maximum
Okay.
correction we are getting with glasses and therapies. If it is left, then we think about the surgery, and they are correctable,
Understood.
100% correctable squint.
And I think just a few years back, like 20, 30 years ago, if I remember this correctly, there was this information that squint can only be corrected by surgery. So it's good, mommies, to stay updated. So let's say if your parents heard something when they were children, don't go with that information. Go to an eye specialist.
Yeah.
Talk to them if you have an issue, because they would guide you according to your child's condition. Squint, as Dr. Shalini said, it can be corrected. It's not permanent. It's all dependent on your child's condition. So before taking any decisions on hearsay, because what you heard years ago, go to an eye specialist. And that's why it's important. And as Dr. Shalini has her own uh, uh, center in Ghaziabad at Vaishali, Samyak Center, Eye Care Center. You can always visit if you stay close to her. You can even connect with her, as I've already shared the number, and I'm sure she will guide you accordingly. So thank you for talking about that, Dr. Shalini.
Yeah.
There's another thing that I've heard a lot, and there are lots of questions coming. Jigisha, I saw your question. I will definitely take it up. I've been hearing about this Ortho K lenses.
Yeah.
If you could let us know what is that and how does that help?
Ortho K lens actually is related to a term which is called orthokeratology.
Okay,
Orthokeratology means reshaping of the cornea.
okay,
Most of the times, most of us has heard about the normal contact lenses, the contact lenses
okay,
which we wear during the daytime and remove when we are sleeping. This is the normal contact lenses are basically uh, you can say replacement of glasses or LASIK surgery. Ortho K is
okay,
little different lens. Ortho K lenses we wear during night time, and it
okay,
works on reshaping of cornea. Once we wear
okay,
the contact lens and sleep with the contact lenses, in the morning we remove the contact lenses and vision is clear without any correction, without any glasses, without any type of contact lenses. So vision is clear for the next 14 to 16 hours. Again, you are sleeping with the lens and the vision is clear throughout the day. Basically, Ortho K lenses was designed to control myopia. It's a method
okay.
of slowing down myopia. The
And
minus
can it
number
be
increase.
yeah? Can it be used for children as well?
It is
At
it
what
is meant
age?
for it is meant for children only actually to
Really?
slow down.
Because
Yeah,
yeah,
it is to slow down minus number. Just few minutes back we
okay,
were talking about myopia.
yes,
Myopia
myopia,
is
exactly.
progressive number of minus glasses. Okay,
Yeah,
to slow down I told you that there are environmental modifications, no to digital gadgets and all. And
yes,
the
yes.
treatment part is there are specialized ortho K lenses. We give these lenses to children only. They wear the
Okay,
lenses during night time, and in the morning they remove the contact lenses. They go school without any correction. Everything is clear to them. During night they again put it. How does it
and
work?
they don't even need the glasses.
No, they don't need glasses during that time. No, because
In the
for
morning.
14 16 from morning to night, they are not
Yeah.
wearing any correction because our cornea has compressed with the contact
Wow.
lenses. It works on reshaping. You must have heard about LASIK, permanent removal
Yeah.
of the glasses.
Yes.
What
Yes.
is that?
Yes.
That is permanent reshaping of cornea. We do the
Okay.
LASIK, and there is a permanent reshaping of cornea for 20-22 years. The same way ortho K lenses work, but it works for 14 to 16 hours. First,
Okay.
the child is free from the glasses. Secondly, it slow down the myopia. Yeah, means the progression rate of minus numbers slow down with ortho K. So the cause why the ortho K lenses were invented is to slow down myopia. So they are very special contact lenses and very
That is
helpful.
that is fantastic to know, because I had heard about it, but I didn't know how it'll help. It can
Yeah.
definitely help my child. And I had another question, which is I think linked to this question. How early can you start lenses for kids? So let's say there are other lenses in the market also, which are number lenses, right? And then there is ortho K lenses. How early can you start it with your children?
Ortho K lenses we start at the age of 4 5 years.
Wow. Okay. All
Yeah,
right.
and normal lenses, you will be very surprised. My youngest patient, in whom I started contact lens, was 3 month old.
Okay.
Why did I start that contact lens? Because that child had congenital cataract, means cataract since birth.
Okay.
Most of the people know that cataract is an aging process, like our growing
Yes.
of hair, the lens also become white. But sometimes there are certain situations where the child is born with congenital cataract. Okay, in cataract, if we don't remove that cataract, the child will be blind. because he's not able to see anything. So we have to
Understood.
remove the lens. Once we have removed that cataractous lens, the eye is so small we cannot put the artificial lens, the IOLs, what generally we put after cataract surgery in aged people. When we remove the lens, the power of the eye has become plus 32 plus 34 diopters. We
Okay.
cannot provide plus 32 plus 34 diopter glasses to a 3-month old child. And if
Yes.
we don't give any correction, the eye will be lazy. So what is the solution? We have given plus 32 contact lenses. We taught mother how to put contact lenses and how to remove. Those are extended wear lenses. Like for 1 week or so, they can leave the lens inside the eye. Generally, we have to remove the lens while sleeping, but those are extended wear lenses that can be used
Okay.
for 1 week or so, and then we clean it and then we put it again. So mother used to, we train the mothers and they are doing it. So we have to decide like what is the cause. We have to weigh, we have to balance profit and loss ratio at the cost of sight. We cannot think that the child is 3 months old, we cannot give contact lenses. At that stage also we have to prescribe. So we have to decide what is the stage, what is my aim to gain. If the child
Yes.
is comfortable with glasses, first choice is always glasses. But sometimes if the number is very high and it is affecting the
Mhm.
development of the vision of a child, we have to prescribe contact lenses at any age. So there is no actually age for contact lenses. It changes
Okay.
with situation to situation.
So the Ortho K lenses, they can be used if you have myopia,
Yes,
right?
it is for myopia only.
It's for myopia. Okay.
Yeah.
So, ladies, we learn every day, and this was brand new information. I'm definitely going to explore it for my daughter, Dr. Shalini. So, if you're looking at this to make sure that you are correcting while your child is sleeping, and that can actually help them not
Yes.
wearing glasses. So, you can always look out for ortho K lenses, do your research, and go to an eye specialist. Dr. Shali, there's so many questions coming up, so I'm just going to ask last two questions, and then
Yeah.
we will start taking up the questions because I know you have limited time. Why do you need to go to an eye specialist? This was a question asked. Number तो कहीं पे भी check हो जाता है. हर eye shop पे there is a machine, they'll check the number. I told them that no, for children especially, you need to dilate the eyes and get your numbers tested with an eye specialist. तो दिस इज व्हाट आई गॉट. ये तो ऐसे ही है, इसकी कोई जरूरत नहीं है, नंबर तो कहीं पे भी चेक हो जाता है. नाउ वी वांट यू टू लेट ऑल द मॉम्स नो why you need to go to a specialist, why you need to dilate children's eyes, because that's how the correct way to give out the power.
First, first of all, I want to convey a message to all. Eye examination doesn't mean sight testing.
Yeah.
Okay, eye is a organ where a lot of functions, are has importance. Sight testing is not eye examination, and that sight testing is not correct when you are going to an optical shop or they are doing it with computer thing.
Yeah.
uh, Whenever my patients ask, no, like, why don't you do that computerized test, wo to yahan ho jata hai wahan ho jata hai, why don't you do that? So I always give an answer. जिसको रोटी बनानी नहीं आती है ना, वो रोटी मेकर यूज करता है. जिसको रोटी बनानी आती है, वो अपने हाथ से रोटी बनाता है. Getting my point?
That's good.
So,
Yes.
first of all, eye examination is not equivalent to sight testing. Secondly, that sight testing, if I have a computer and I ask anyone, just stand here, take a picture and take out the number. It's not that easy job. Okay, you are
Yeah.
giving prescription to someone, and this practice is common in India only. It is not an authenticated practice. First of all,
Okay.
this is not, yeah, we should not go for all these tests. Opticians are meant to make a prescription on doctor's prescription. They are meant to make glasses on the doctor's prescription. They are not meant to check eyesight. Secondly, when we dilate, we see a lot of things, like, first of all, your other eye parameters, like whether do you have any other changes like early cataract or glaucoma or any other retinal changes. You
Yeah.
must be surprised. While examining the eye, in 40% of cases, we diagnose blood pressure changes, sugar changes, thyroid changes, even tuberculosis, AIDS, and even cancer. A
Yeah.
thorough eye examination can detect all these things. So in my patient clientele, about 40% of patients, they didn't know about all these things. I
Yes.
once I see the eye after dilatation and I ask them to go for these checkups and come with the report. Then they are surprised, oh, I have sugar, I have blood pressure. So
Oh
these
wow.
are the things, which affect your eye also, and you never know. These are silent changes. Until unless
Yes.
we see your eye and other parameters, we cannot say. So first of all, a dilated examination is a must to assess whether there is any other situation which is prevailing in your eye. Secondly, until unless we dilate, we cannot reach a correct number also, because our muscles, ciliary muscles interfere. When we are putting the dilating drops, we are dilating your eyes and we are relaxing your muscles. At that
Yes.
particular time, your muscles cannot interfere in that, in that function. So we are able to know the exact refractive status of your eye. So that is the correct way of examining. So that is not an alternate. Sight testing is not an alternate. And secondly, the surprise is once you go for that sight testing, you feel that you have gone in under eye examination. So something, like silent changes like glaucoma. Glaucoma is a
Yes.
silent killer of the vision. It's a deadly disease. The whatever vision we lose in glaucoma, we cannot regain. And the
Mhm.
only method how to investigate glaucoma in early stage is dilatation. So there is no alternative to a dilated examination. It is a
Understood.
must for your glasses also, and for other eye health and other issues also, or diabetes, BP, and many things. So there is no
Yes.
alternate of that. So don't confuse with sight testing that it's an eye examination. It's not.
Exactly. So eye examination is different. You come to know again. That is
Yeah.
why experts are experts. They have studied, the whole thing, the eyes. They know in and out all issues that could be related to your eyes. You just can't go to a shop and think that that person is going to guide you the way you need to be guided. So that is why you need to go to a specialist, get yourself checked, because as doctor said, there are lots more things included than just eye testing. It's not just eye testing. um, Dr. Shalini, we'll ask one more question, as I said, before opening it to the questions asked by people. Um, so, A, we were talking about mothers, we have been talking about children. They feel that, as you said, till the time things are not wrong, they will not go get anything tested. It could be anything. I'm just talking about, keep talking about, we say that you need to get yourself, the whole body checkups are needed every 6 months, a year. They'll be like, nahi, jab tak nahi dard hoga, jab tak issue nahi aayega, tab
अभी
tak
तो
hum
कोई
kuch nahi
परेशानी
karne
नहीं है. अभी तो कुछ नहीं है.
Exactly. So when it comes to eyes, we all have heard and we all know that once you cross 40, um, there is something that you might end up needing glasses if you've not had glasses all your life. If you could
Yes.
just explain why that that happens and why moms need to make sure that they are going for regular checkups.
Very good question, Amita. See, I was just talking about the ciliary muscles action. Like we put the dilating drops and relaxes the muscles action. Our muscles do a very good job. Like when we are looking at a distance target, they adjust our own lens, focal length for a distance thing. And when we are looking something at near, they adjust the focal length for near. This is done with
Mhm.
the help of our ciliary muscles. While up to reaching 38, 39, 40, the action of those muscles reduces, and
Yeah.
now we are not able to switch focus from a distance to a near target or near to a distance target that swiftly that we were doing before 40. So it's a
Okay.
normal age related change. It happens to everyone. Now in case of females, we at the age of 40, there are a lot of changes which are taking place at that particular time. Like it's a menopausal time, lot of hormonal changes, lot of
Mhm.
things are going at that time. So at the age of 40 or 41, even males also require reading glasses. But
Yeah.
our issues are little different from males because we are facing hormonal changes also that time. And hormones affect our ciliary muscles action more. Secondly, tear formation, lot of dryness we face when we are going towards menopause. Okay, so these hormonal changes, you must have noticed, like hair fall and dry eye issues, skin dryness. There are a lot of issues which are taking place around that age group. So it is a must. it is even thyroid situations. So that decade, 40 to 50 decade, is very important for all of us, especially females, because we are facing a lot of other issues also. So
Yeah.
it is a mandatory thing, like we should go for once in a year examination, whole body examination, and dilated examination for eye, just to see whether we are facing any other issue related to our hormonal changes. So it is a must. Do not We should not actually avoid this. We should take care of ourselves. When we are taking care of ourselves, then only we'll be able to take care of our near ones or dear ones. So it is important. It is equally important to get yourself examined.
All right. Perfect.
Once in a
So
year. Once in a year.
once in a year. So
Yeah.
while you're just taking your child, please थोड़ा सा extra time निकालिए अपने लिए भी. So when you, yeah, because I think after this session, the parents will realize कि okay, we need to take our children for an eye checkup every year. You also need an eye checkup every year. So this Mother's Day, make a promise to yourself that you're going to make yourself a priority as well. So while you're taking your children for the eye checkup to an eye specialist, please take out time for yourself and get your eyes checked as well. So somebody had asked Dr. Shalini, among a lot of other questions, but this was something that a lot of them had asked. How to come to know? Sorry, I just don't know which question I clicked.
Okay.
Sorry. Yeah. So the question that was asked was how to come to know if my child, if they're, so this question is only applicable if they're not going for regular checkups. What are those symptoms? Because they said my child is watching a lot of TV, they're rubbing their eyes a lot, the eyes are red. What are the symptoms that are the first ones that a parent can detect that the child needs to go to an eye specialist?
Okay. First of all, the answer is hidden in the question itself.
Yeah.
Okay. So first of all, like whenever the child is showing some symptoms like rubbing eyes, watering eyes, pain, headache, watching TV from a closer distance, means he's not able to see things from a distance. These are
Yes.
all hidden symptoms that he needs an eye examination. Secondly, if sometimes the situations are like that we are not able to go out, like during COVID situations, people were quarantined or these things, they can go to my website. I have a vision chart uploaded on my site.
Oh,
They can
fantastic.
take out the printout from the my website, and they can check the vision at home also. And
Oh,
I have my YouTube channel, and this issue I have full video on this, how to examine your child at home if you are not going to an eye specialist. Before going to an eye specialist, you want to check yourself, you can do it at home. So they can go to
okay.
my YouTube channel and my website. Everything is available there. Otherwise, these
Okay.
symptoms are sufficient to take him to an eye examination. It's a hint
All right.
that
And so, what is your YouTube channel? We would love to know your YouTube channel.
yeah, it's by the name of Dr. Shalini Samyak Eye Care Clinic.
Okay. We'll share that also, moms. Once the session is done, we'll share the information about Dr. Shalini, her clinic. We'll share her website, which is where she mentioned that the test is happening, which is www.samyakeyecare.com.
Yeah, every
And
link
we'll
is
share,
available there also. For my
yeah,
YouTube channel link is also there, and every
and we will
Tuesday,
share, yeah. We'll share her
every
number as well, which
yeah,
is 9899960700. I'm just saying sometimes you
yeah,
don't read, you would like me to say out things. We'll share all the information once the session is done. This test sounds really interesting, Dr. Shalini. So if you're concerned that COVID is still there and you don't want to head out, you can check out the test on the website.
yeah.
Fantastic, Dr. Shalini. I know we are running out of time. There are a lot of questions that we still could not pick up. A lot of them, actually, I'm reading through the questions. They are those basic concerns that parents have. I think you should go consult an expert. If you feel that even there's a little bit of chance, like redness, somebody saying their eyes, the eyes are watery, all those kind of, those all are signs that your child needs to go and get
Yes,
their eyes checked.
these eyes are not comfortable.
Yeah. So those all are like little symptoms that your child is not sharing. अभी थोड़ी देर में अगर आप नहीं करेंगे, in a few months you will see that they will squint their eyes to watch like this. They'll go closer to the TV. So before that happens, as Dr. Shalini explained, take your child to an expert. She has her center, the Samyak Eye Care Center at Vaishali, Ghaziabad. You can go visit her. I'm sure she'll help out. And for any other queries, we do have her number. We do have her website. We'll share everything and you can connect. Dr. Shalini, thank you so much for taking out time to be a part of this live session. So this is our, I'm not sure if,
It's my privilege.
can you hear me? Is my video
Yeah,
okay?
yeah, it's okay.
Okay, perfect. So thank you so much for your time. And we would close with one last tip from you, Dr. Shalini. Is there any exercise or a method which can improve a child's learning, reading, or academic performance? Is there anything
Definitely.
that you can recommend?
Yes, definitely. Now, again, I want to clear one doubt. Most of the times, we don't know the difference between sight and vision.
Yes.
When we talk about vision, we are talking about sight actually. Sight is a function of eye, and vision is a function of brain. Okay,
Okay.
our vision is made up of 17 or 18 visual abilities. Out of those 17, 18 visual abilities, sight is one ability. So most of the times we are just focused on one ability. We are not focusing on other abilities. Vision is a compiled form of 17, 18 visual abilities. Those visual abilities are like concentration, tracking, focusing. Sometimes you must have seen, like in class, there are 40, 50 students. Everyone has
Yes.
got good vision, with whether glasses or without glasses. They have good sight,
Mhm.
but all of them are not reading properly. Some child is facing difficulty in writing, some of them are
Yes.
facing in reading comprehension, some of them are lacking in completion of homework, handwriting. So what are those things? Those are visual abilities. Whatever our eye sees, our brain processes that information. How accurately, how fast that information is being processed by brain, this is called vision. And we can improve the vision with the help of vision therapy. So there are customized programs to improve those abilities, to get the 100% academic performance. Most of the times what we sometimes the child comes with the diagnosis of dyslexia, you know
Yeah.
attention
Mhm.
hyper deficit syndrome, ADDS. These are
Mhm.
generally, the syndromes are not there. Most of the time they are facing some of the visual ability difficulty, and they just want to overcome those difficulties with the help of exercises or other methods. So these abilities can be taken care of with the help of vision therapy, and it can improve the child's handwriting comprehension, reading comprehension, focus, scanning, and attention, and visual memory. So there are a lot of things. We have a specialized software to assess all those abilities, and particularly whatever ability is lacking in the child, we can work on those abilities, and children get a lot of 100% results with that. So first of all, the confusion should be clear. Sight and vision different. Sight is function of eye, and vision is a function of brain. We can improve visual abilities.
Wow.
So,
So we learn something new every day.
so it's a
Yeah.
good concept, and it's a very new concept to India, but I'm doing it for the last 10, 12 years, and my kids
Wow.
are doing, my small kids, they are doing it, and they are getting the results. You can go to my testimonial videos also on YouTube. They can find a lot of parents talking about vision therapy and the academic performance the child has improved with those therapies. So
Wow.
we should actually take care of visual abilities also, other than sight. Sometimes the child is not able to see things. Just we go for, okay, child is able to see 6:6. It's okay, but it's not okay. The visual ability should be tested, whether he is able to use that information properly or not. It should be
Yeah.
assessed.
So
So
vision
vision
and sight are different, as Dr. Shalini very beautifully explained. And there is something called vision therapy. I think my takeaway from the session, Dr. Shalini, are three really important things that I learned. Those are your child. You should not wait till they are 6 to 8 years old to take them for an eye checkup. It starts at 6 months, and you can go for a regular checkup every year, which is a must. You should do that. The second
yes,
thing is vision therapy, how it can help your children on all the different issues that you mentioned. Again, you sometimes you just don't think about it. how it's impacting your child. So till the time you are aware about it, uh, which I think we are now today after your session, I'm sure a lot of moms would have heard these terms for the first time. You can connect with Dr. Shalini. She will help you out more. And the third was the Ortho K lenses. That was brand new information. Now I know the purpose behind them. They all are fantastic. So these are the key takeaways, the things that new things that we learned about. And all thanks to you, Dr. Shalini.
Thank you.
Yes.
Thank you. It's my
So,
pleasure to be with you.
yes. Again, before I close the session, thank you all to all the moms and wishing you all a happy Mother's Day. To you also, Dr. Shalini Jain.
Yeah, same to
And
you. Happy Mother's Day.
yeah, thank you so
Thank
much.
you.
And
Thank you.
I would share all your information. I'm going to share your website. I'll share your YouTube channel. Dr. Shalini Jain has her own eye care center, which is Samyak Eye Care Center, clinic at Vaishali, Ghaziabad. We will share her contact details. If you need any more information, you know whom to connect. Thank you so much, Shalini,
Thank
Dr.
you.
Shalini, for this wonderful session.
Thank you.
Thank you
Bye
so
bye.
much.
Bye.
Bye.